As we age, the risk of developing cancer goes up. In fact, older adults make up the majority of cancer patients. A geriatric oncologist helps to care for older patients during their cancer journey. And joining us now to talk more about the care of these special patients with cancer is our geriatric oncologist, Dr. Rawad Elias from Hartford Healthcare Cancer Institute. Good evening, Dr. Elias. Thanks for being with us tonight.
Good evening. Thank you for having me.
Well, first question is, why do you find that more adults over the age of 65 are at such a greater risk of developing cancer? Is it just because they've lived longer, they've been exposed to more things?
Yeah, so the highest incidence of cancer and mortality rates is in patients 65 and older. This is because of changes that our body goes through as we age and also longer exposure to risk factors.
All right. And then the second question I have for you, given all that, what can be done to help older adults as they are starting their cancer treatment? It can be a very scary and confusing time.
Yeah, that's very true. So older adults have needs that are very different from younger patients as they go through the cancer treatment. And these needs can be physical, can be mental, can be social. And it is important to address these needs as they go through the treatment to support them and to get the best outcomes.
So what are some of the ways that you address the needs?
So we do what we call a geriatric assessment, or the one we use here is called the Rapid Fitness Assessment that was developed by the Memorial Sloan Kettering Cancer Center. And that assessment goes over with multiple aspects, social, mental, nutritional, medical, and other. And we try to see where we can support these patients by identifying deficits, and then we implement interventions based on that.
I know you wanted to talk about screening, screening for cancer. Can it be done with your primary care physician, or do you need referral to someone like yourself?
No, so the screening for cancers is usually done by the primary care physician. What we do as a geriatric oncology program or a cancer and aging program is Hartford Healthcare is to work with older adults who are already diagnosed with cancer and who are about to start their cancer treatment, as we form a multidisciplinary team. So it's a comprehensive team: nurses, nutritionists, physical therapists, occupational therapists, and medical doctors. And we try to form, based from multiple standpoints, a best plan to help patients as they go through the cancer treatment.
All right. Thank you so much, Dr. Elias, for sharing that great information with us. And we know that you have a talk coming up. Actually, I believe it's this week. It's a free community education talk open to the public this Friday, September 27th, from 3 to 4 p.m. at Doncaster in Bloomfield. And if you'd like to sign up or get more information, just call the number you see on the screen. In the meantime, Dr. Elias will be answering your questions and a live Facebook discussion happening right now on the Hartford Healthcare Facebook page.